I'm Dr. Hollenberg, and I'm working at the University of Calgary along with Dr. Eric Heinemann, who's my partner, urologist. And I'd like to talk to you about the progress we've made with the Ride for Dad funds that you provided us over the past year or so. Now, the main problem that we're trying to tackle is to distinguish aggressive prostate cancer from indolent cancer. And the tests we have so far are not too good at doing that. The prostate-specific antigen, or PSA test, or looking at the cells and giving it a score called a Gleason score, really can't tell us if those cells in the body are going to be aggressive and gallop away with the cancer or just sit there and wait. So our idea is that in the environment, in the neighborhood of a cancer cell, there are digestive enzymes that chop the cell surface and give the cell a signal and allow it to grow and invade. And the working idea we have is that the environment proteolytic enzymes, digestive enzymes, give the cell the signal to invade and metastasize, and aggressive tumors will have lots of those enzymes and activate lots of the signals compared to the indolent ones. So over the past year, we've been using the funds to develop the following tools. What is shown here is a receptor that we can put into the cell artificially that has a yellow, a red, and a green tag on it, so that when it's in the cell and it's intact, it looks yellow. But if an enzyme comes along and chops the end off, the red goes away and the receptor becomes green. So we now have a tool to ask the question, in those cells, in the tumor cells, is the receptor yellow, inactive, or green, active? Another way that we've developed over the past year, and it's just been published in Molecular Pharmacology with acknowledgement of Ride for Dad support, is a really neat idea where you put a fluorescent tag on the end of the receptor outside the cell, so that when one of those neighborhood enzymes comes along and chops the end, it releases the fluorescence into the supernatant as a signal that our favorite target has been chopped. Now, how does that look in an honest-to-goodness tumor cell? In this picture here, there's a prostate cancer cell that's come from a bone metastasis, so-called PC3 cell. When we put our receptor with the red and the green tags in there, it turns out to be green. And what that says is in this cell environment, it's putting out enzymes that are activating it and will therefore drive it to metastasize and invade. However, in a background cell, it looks yellow, and this cell won't metastasize and invade. What we now know is that turning the yellow receptor to green, so this is the receptor inside the cell, and it's coming out. As soon as it gets outside, it goes green, gets active, starts driving the truck. We know that there's a very specific enzyme that we can block, which will make the green go back to yellow again on the outside. So in summary, the progress over the last year that we just published about with Ride for Dad credit lets us look at cells that could come from a tumor or from a biopsy and ask the question, are those cells making these enzymes that will make the tumor aggressive, or are they not? Are they activating our triggers, or are they not? And by using that information, we would hope to have a diagnostic that would allow us to avoid doing surgery and lots of chemotherapy on non-aggressive tumors and focus on the aggressive ones. So without the Ride for Dad funding to help us do this, we wouldn't be where we are today. And for that, Dr. Eric Heinemann and myself are really grateful. So thanks very much.